Hello, I'm speaking to you from the Exchange overlooking the River Parrett and following the March board meeting. As promised, I'm going to take this opportunity to let you know about some of the things we discussed during the board meeting, which I think might be of interest to you. It was a pretty busy agenda. We covered lots of ground. The meeting included a presentation in relation to last year's staff survey. We've now received the report in relation to the survey, which included feedback from 1,700 colleagues across the organisation. There were some positives, but also there are a number of negatives. I suppose one of the things which was particularly disappointing was that only 70% of those colleagues who were surveyed thought that the care of patients was the Trust's overarching priority. Now, whilst this is not that different from many other similar organisations, the figure is clearly disappointing, and overall the survey identified that there are a number of areas where we need to improve staff engagement going forward, and that clearly will be a focus for us. I suppose putting the survey to one side, it's also important just to flag up some of the feedback we've received from the Care Quality Commission. During the report, we fed back regarding what the CQC told us immediately following their re-inspection earlier this month, and they identified a lot of positives in relation to the trust culture and the level of engagement across the organisation. So that's something to be pleased about, and it'll be interesting to see what the final report says in relation to that when we receive it, hopefully towards the end of April this year. During the board meeting, we also received a report in relation to the mental health community survey, which was carried out last year, and looked at the care that about 250 of our patients were receiving. Overall, 70% of respondents said that they were largely happy with the quality of care they were receiving. Again, there are a number of positives, but also a number of areas where we need to improve, particularly in relation to how we communicate with our mental health patients in the community and how we make them aware of what they should do in the event of a crisis and who's actually overall responsible for their care. Andy Heron, who's our Chief Operating Officer, during the meeting gave us an update regarding the number of beds that are currently open across our 13 community hospitals. We currently are running at 263 beds, which is a number that we agreed we'd have over the winter months. The plan is to continue with that number until the end of April, in light of the continuing pressures that our acute colleagues are experiencing. And in relation to this, you'll be aware that we've done a lot of good work to try and reduce the number of delayed transfers of care across the Somerset Health and Social Care system. We've now appointed on a permanent basis 2 joint pathway management leads. They are Jessica Dolman-Sellers, who will be working with colleagues at YDH, and Holly Cam, who will be working with colleagues at Taunton and Somerset to improve the throughput of patients and reduce delays. And their roles already, I think, have had a fairly major impact across the system. So I'm really pleased that we've been able to make those permanent appointments. The meeting also looked at the quality priorities that have been developed following consultation with our members, our governors and colleagues across the organisation for the next financial year. These have now been approved by the board, and I'll include detail of these priorities in my next blog, which hopefully should be up on the intranet towards the end of this week. During the meeting, we normally have a patient story, which is an opportunity for board members, particularly our non-executive colleagues, to hear directly from one of our service users or patients regarding their experience of the care we provide. Unfortunately, this month, the 2 patients we had hoped would be able to join us were unable to do so. So that's a little disappointing, but we'll certainly have a patient story for the next board meeting. Finally, during the meeting we received an update from Nick Macklin in his capacity as Director of Workforce and Organisational Development regarding the Trust plans to employ apprentices. This is a really exciting initiative, and I'm really pleased that the Trust is going to do this, not least because it will be a way of getting more younger colleagues working in the Trust. One of the striking things about the organisation is our age profile. So currently only 4% of our workforce, which is nearly 3,900 strong, are aged under 25. That compares to a national average in excess of 12%. So that will tell you that there's work that we need to do to try and recruit more young people and hopefully ensure that they have really long and productive careers working for Somerset Partnership. Those are some of the highlights from this month's board meeting. The board papers will be available via the intranet and also our website, and I'll also cover a bit more about what we discussed during the board meeting in my blog, as I mentioned earlier. Thanks again for your time, and look forward to seeing you soon. Bye.